Oh, it's lovely to see you all. Thanks to Deepika and Yandev for asking me to share some information about mental health today. So I think I've done a presentation. I'm hoping that there's going to be lots of discussions around this. Obviously then, hopefully that you'll be able to share your perspectives, and that we'll also get some yoga perspectives on things as well, and sort of how we can work the yoga in for people with mental health issues, and then talking a bit about mental health as well. So I'm going to hopefully share my screen. And can everybody see that okay? Yeah, brilliant, thank you. So yeah, just introducing really, I mean, Dr. Anand has already talked on mental health conditions, so, you know, hard act to follow, I think, sort of, but hopefully, I mean, I think he talked a lot from his perspective and sort of what he's been doing. You know, we can go a little bit deeper into the medical sort of side of things and sort of some of the conditions, and hopefully, yeah, go on and discuss with us all, really. Hang on 2 seconds. I think I need to let people in. There we are. Right. So I mean, mental health covers a huge wide range of topics. And this is not something that we're going to be able to cover fully in one session. So just the aims today really to introduce the common mental health conditions that you'll probably see and that I'm seeing all the time as a GP as well. And then how to kind of approach things in your assessments, and how to practice really safely and sensibly when you're doing your assessments there, where to ask for help, because I think, you know, that's one thing I want to get across really with people with mental health issues. You know, you won't be going this alone. You know, I think you will need backup. So you'll need to either involve other agencies or health professionals, mental health professionals. So kind of knowing where you need to get help from and where to seek that help for people. So mental health refers to a person's cognitive, emotional well-being. So it's how they feel and how they behave. And mental health problems can have a huge impact on people's lives. You know, so it affects all aspects of their lives, their physical and their mental health and their social health as well. So it's a really big impact on people. You know, and I think sort of this, over the last 20 years since I've been practicing, I've seen lots and lots of changes really, and there used to be a really big stigma with mental health issues, and people would come in and be really find it really difficult to talk about them, find it really sort of difficult to open up. But it's much more accepted, you know, that, and you'll often hear now, everyone has mental health, which I don't necessarily like that phrase, sort of, because I think sometimes it makes you feel like everybody's got mental health problems, which, you know, is not sort of the case as well. But luckily, I think at the moment, there's a lot more, especially for younger people are a lot more open about talking about their mental health. And if they are struggling, I think people are a lot more willing to come forward and get help, which is a really good thing. So I think, yeah, everybody has mental health. So I think, you know, you can think everybody has a mental landscape that we all need to look after and take care of. You know, I think of it like that, really. You know, we need to sort of look after our mental health and look after you know, our well-being, and that's really important to help prevent problems. But not everybody's got mental health issues. You know, I think we need to be able to judge and draw the line really when something's a mental health problem, and when something's really affecting somebody's life and it's got to the point where it's pathological, and where they need to seek medical help. And you know, and I think sometimes that's part of my job is kind of separating what is illness from what's in normal human behavior. You know, I get some people coming to talk to me, and, you know, they're getting lots of symptoms and they're feeling really sort of not great. But what they're experiencing is actually a normal reaction to the situation that they're in. So it may be a bereavement, it might be a really stressful situation. And so helping them accept that that's a normal reaction, you know, and then they're not unwell, but things do need to sort of, you know, they sometimes need some help with that. You know, and then often people don't recognize when they are really unwell. So you will get the other end of the spectrum, people coming to see you with lots of sort of issues that they're not aware of, and you know, maybe sort of exploring their mental health with them, which is something that they've not thought about before. So it's not always easy to really define what's going on. And I think, as I said, always best to get help and get sort of somebody who can make a judgment, who's trained in mental health, or a trained health professional. You know, if you feel maybe something there, then ask your care seekers to go and get some extra help if need be. And you know, there's huge overlap as well between mental health and physical health. You know, people with mental health issues are at much greater risk of physical health problems, and also symptoms of mental health can manifest as physical symptoms. So it's a little bit of a messy, muddy waters, you know, and I think, you know, lots of people with chronic illness as well suffer with mental health issues like depression. And, you know, as we know as yoga therapists, you can't separate the two into sort of different boxes. You know, you need to work together with the physical body and with the psychological side as well, isn't it, to bring together for health. So I actually pinched this slide from Dr. Ananda. I've quoted him there that sort of, I think, if we're doing yoga therapy and if we're focusing on those pathogenic aspects, what he said was, it looks like yoga therapy, but it's not it. So it's just a reminder, because we're talking a lot about illness today and we're talking about mental health issues and diagnosis. But for yoga therapists, really, I think Dr. Ananda wants us to focus on that salutogenesis. So that wellness paradigm, which is on a different level to the sort of treatment paradigm. You know, something that I think it's a really subtle and sort of interesting point, and something that I struggle with because I'm so used to working in the medical sort of treatment sort of dimension. So it's switching our thinking really as yoga therapists, you know, not focusing on diagnosis and treatment, but looking about wellness and sort of that whole spectrum really of trying to improve people's health, focusing on health and but not focusing on illnesses really. So really common mental health issues. About a quarter of people will experience a mental health problem in the course of a year. And it's something I see probably 5 or 6 patients at least a day who've got significant mental health issues, I suppose. And I think mental health is becoming more common for a variety of reasons. I think it's probably more recognised, but I think things are more stressful, and I think people are living in such a way where they are more at risk of developing mental health issues. And there's lots of different sort of diagnoses then, or little boxes that we sort of put people into when they're having mental health issues, to try and describe what's going on and to help us sort of guide us with treatment as well. So the commonest things that we see are sort of things like anxiety, depression, things like OCD, post-traumatic stress, and I know we've discussed trauma and stress quite a bit previously, so I'm not going to go too much into that. I think Deepak is also going to talk about addiction for us as well. And so lots of ways of describing how people are feeling really, and how that illness is manifesting, and it's very different in every individual. So even if you think about, you know, depression is not one illness, it's just a description of how people are feeling. One person or one care seeker with depression will be completely different to another care seeker with depression, and the same goes for, you know, across the spectrum. So there's not one rule or one guide fits all. It's taking a really individualized approach with people and trying to find and work through things with them. Just to mention as well, sort of what's not a mental health condition, because there is sometimes a little bit of confusion. So we wouldn't class things like dementia and neurological conditions, so things like cerebral palsy or people who've had brain injuries, we wouldn't class it as a mental health condition. It's more of a neurological, physical sort of neurological condition, that one. And also then neurodevelopmental issues, so things like dyslexia, autism, and then sort of possibly sort of learning difficulties and things, they're not mental health conditions either. So that's a different sort of thing. And there is a little subtle difference, and sort of, you know, I think got to be a little bit careful, you know, in when we're labeling things as mental health conditions. Although lots of people who do have conditions like dementia and autism do also suffer with mental health issues. So can be a little bit complicated, just sort of pulling things apart. So probably one of the most common things in terms of mental health problems that I'll be dealing with is depression. It's really, really common. I think maybe 1 in 3, 1 in 4 people will experience depression at some point in their life. You know, it's more than just feeling sad, which, you know, again, that probably lies a little bit within the realms of normal human experience. You know, we all have down days. We all feel sort of not motivated, lack of energy sometimes. But depression is a lot more than that. It's a kind of total mind-body illness, which encompasses low mood, difficulty sleeping, lack of energy, and real sort of chronic sort of fatigue that people can't sort of fight their way out of, lack of motivation, and just feeling that they're not enjoying anything. You know, the things that they would normally go and sort of that would brighten them up, they can't be bothered, and people feel sometimes they describe it as like a flat feeling or just numb. Sometimes even a bit dissociated, and just that they're not really engaging and sort of not themselves is something that people describe. Lots of negative thought patterns can go with that as well. So lots of low self-esteem or feeling bad about things, feeling that the world's against people, and that can even, you know, result in feelings of real hopelessness and sort of suicidal thoughts sometimes as well. The symptoms with depression are persistent. So it's, you know, to define depression, it has to last more than 2 weeks. And often you may get other physical symptoms like headaches, general aches and pains, tiredness, and people come in with those symptoms. And it's not something that people could just snap out of. You know, and I think in the past as well, there was sometimes a lack of understanding and people feeling that, you know, just come on, pick yourself up out of it. And it's really difficult. If you're suffering with true depression, you can't snap out of it. It's an illness. You're not going to just be able to fix it quickly. And it can sometimes be triggered by life events, or sometimes there's just no trigger for some people. Often it does run in families a little bit, but some people just, you know, it comes from nowhere really, and really takes people by surprise, and they find it really difficult to understand what's happening to them. So with depression, you tend to get sort of people falling into these kind of, way of describing it is like a negative cycle or a downward spiral really. So they start feeling bad, and then they sort of do less, and then things get worse, and then maybe something else happens that makes them feel more sad, and then they just get into this real hole with things. So I think anything that we can do to try and reverse that, you know, because I think sometimes it is a step-by-step process then of doing a little bit of something that makes them feel better, that then sort of makes them feel a little bit more energy and a little bit more motivated to do something else. So reversing those negative spirals that people get into with their thinking patterns and their behaviour. You know, I think medications we do use for people who are really, really stuck in that hole, and they're mostly based on the serotonin systems in our brains, and they do, for some people, really make a big difference. They don't work for everybody, but it can sometimes just be enough to sort of kick people out of that real sort of hole that they're in. And some people do need sort of medication long term if they're sort of chronically suffering with depression as well. The other treatments that we use then are sort of things like counselling and therapies like CBT and cognitive therapies. But lifestyle changes are really, really important for people with depression. You know, making sure that they are sort of eating properly and sort of doing some activity can really, really help again to reverse those negative spirals. And having time outdoors in nature if you can, healthy social interactions, really, really good. You know, that sense of belonging is so important for people with depression. So I think I'll sort of pause there, and if anybody's got anything that they want to share, or if, you know, if Yandev and Deepika have anything, you know, their thoughts on depression and yoga and sort of, yeah, I'll leave a little moment for discussion before I just keep rabbiting on. I'll have a quick look in the chat as well. Let's have a little look.
Yeah, I think I will talk through once you completed, Kathy, because then I will bring the whole yogic understanding on in one place instead of like dipping it out.
Yeah, I'll carry on then, that's great. But I suppose you can start to think a little bit about people with depression, and what kind of yoga practices and sort of things that you're going to be thinking about, I suppose. So as we're going along, just, maybe make some notes or have a little think. So what kind of things, you're going to need to think about with people. So then another really common thing that we see often goes along with depression as well. The two tend to go together quite a bit. So anxiety, and that's really a group of conditions that encompasses things like panic disorder, OCD, generalized anxiety, where there's no sort of particular one thing. People are just worrying about everything and sort of really anxious. Social anxiety, health anxiety is another one that people are really focused on something going wrong with their own bodies. And that sort of phobia about sort of various different things. Again, really physical and mental symptoms going on, really. So people will get things like palpitations, feeling like there's something stuck in their throat, feeling of choking and breathlessness. And, I suppose you can imagine when you're in that fight or flight sort of fear mode, those physical symptoms often manifest, as well as things like worries, obsessive thoughts, compulsive behaviors, and sort of restlessness. Insomnia is really common with anxiety. And people have difficulty concentrating and focusing as well. We've talked a bit about traumas, and I think sort of really important as well. If there's been previous traumas, and family history again is really important with anxiety. And so we use medications. So we use similar medications that we would use with depression, but there's also psychological therapies, which are really, really important alongside the medications. The one I use is there's a stress course online, which is a free course, and people find it really, really good. There's lots of information on there, and it talks you through some cognitive techniques for anxiety, and it's got links to things about mindfulness, and that's encouraging people to think about how to manage their anxiety. And obviously sort of yoga really, really kind of fits in with this as well. Counselling can be really important, especially if there's traumas and things, and lifestyle. Again, getting adequate sleep is really important, because when you're feeling stressed and you're not sleeping, you get that knock-on sort of fear factor again, and just becoming overwhelmed with anxiety sometimes. I'll talk a little bit about sort of stress and burnout, and they sort of go together a little bit with the anxiety and depression. We've talked loads about stress mechanisms before, sort of right at the beginning of the course, and sort of, I think how stress manifests in our bodies. But we are seeing a lot of people at the moment, especially from the healthcare profession. I think with everything that's been going on over the last year, people are really feeling sort of burnt out, and it's just from sort of working constantly in really, really high pressure environments, and I think feeling drained, feeling overwhelmed, that irritability, and just that feeling of you just haven't got any more to give, that lack of compassion. And I think sometimes it's not, I think sometimes we call it burnout, and it makes it feel like people's fault, and I think it's not that. It's the situation that people are in sometimes. Often see it in teachers as well. So teachers are really, see them commonly with burnout, and it's a really high pressure job, and sort of, I think teachers care so much about their pupils, and they are under a lot of pressure, and I think they tend to be a bit perfectionist sometimes, and they really want all their children to do well. So that they're another group we often see. Carers as well. So if you're looking after somebody who's got a chronic illness, it's really draining, and you tend to feel isolated with that as well. Social care workers, again, really hard job, isn't it? Really, you're seeing things that are really emotionally draining. And sort of farmers as well, sometimes you can see like they're on their own, no holidays, and they work really, really hard. Sometimes manual work is more of a physical burnout sometimes then, because they're having to do so much physical work. So I think it's not just healthcare professionals. I think lots of different people suffer with burnout. I'll have a quick look on the chat because there's some more things coming through. Lecturers too, yes, yeah, teachers, lecturers, definitely. I'll come back to some of the questions then at the end. So yeah, I mean, sort of moving on then, sort of probably more severe mental illness then, and we're thinking about sort of things like psychosis. So again, you know, you're not going to probably miss this one. If somebody has got psychosis, it's usually really, really obvious. You know, they look really unwell, and they are having sort of almost complete breakdown in sort of terms of their thoughts and their behavior in a psychotic episode then. And the three symptoms that people tend to get with psychosis are things like hallucinations, delusions, where they feel something is true and sort of real, but it's not, and that they become completely fixed in their belief that that is true, despite any evidence to the contrary, and often really confused and disturbed thoughts as well. It's a really horrible illness, actually. People lack the insight to know that they're ill, and that's the really difficult thing. You know, and they become unable to function. They may even become a danger to themselves, and sort of often then people need hospital admission for that, and some real specialist help. But with psychosis, people do get treated with medications, and that's often stabilize things. These medications do work and they stop that really acute psychosis, but they do have side effects, and sort of, I suppose, then you're managing things like schizophrenia and psychosis as a chronic illness, sort of as a long-term illness that they're always going to need treatment for. And, you know, you're managing sometimes a bit of the illness and sometimes, you know, side effects of the medication that are controlling that illness. And I think Yandev has worked with patients on an inpatient basis doing yoga therapy. So it'd be interesting at the end perhaps to get his perspective on some of this as well. So again, as well as the medication, really important, the importance of psychological treatment, supportive activities, group support as well. And the prognosis is quite good for people then, you know, but as I said, they may relapse and they may need to take medications in the long term for some patients. So yeah, as I said, we won't go too much into the sort of side of trauma, but just remembering, and there's a little bit of a reminder that trauma is not just the event that happens, but it's that imprint that's left on the individual after a sort of trauma. And people who've had serious trauma are sort of quite wired for stress. So they may present with symptoms like anxiety, depression, insomnia, sort of particular trauma effects as well, like dissociation, concentration difficulties, flashbacks, nightmares, and sort of hyperarousal and sort of sensitivity, you know, feeling that they're always on edge and sort of really anxious. Eating disorders as well, then we've got something that I find really difficult to manage in general practice, because we have so little time with people, and it's something that really people need specialist help with, and it's not always easy to get support, and you know, that's the unfortunate thing, I think, the system that we work in. But there are various different eating disorders. Anorexia tends to be sort of trying to take control of your weight by not eating enough food, or sometimes exercising too much, or a bit of both. But there's other eating disorders as well, sometimes binge eating or bulimia, where you lose control of how much you eat. Really difficult conditions, and again, huge impact on people's lives with these ones. I'm going to mention ADHD, which is something Dr. Ananda mentioned a little bit as well. And you tend to think of ADHD as something that's diagnosed in children, but it's becoming a bit increasingly common in adults as a sort of recognised condition. Often develops in children, and is recognised in children. It tends to be people with a really short attention span, becoming really easily distracted, fidgety, just you know, I think to a really extreme level, because I think sometimes we all get a little bit fidgety, but when it's at a really extreme level, that it's completely making their lives so difficult that they can't function, and you know, sort of not able to organize themselves. We've got a psychiatrist locally who actually does a presentation on this, and he suffers himself with ADHD. So it's really interesting to hear his perspective, and sort of, he talks a little bit about how he manages his illness. So he's able to work, but he says, I need a really good secretary to help him with all of his organization and his focus, and somebody to help sort of pin him down a little bit, because he is quite chaotic, and he's brilliant psychiatrist, and patients absolutely love him. So it goes to show, you know, that I think, you know, ADHD is a little bit of a funny one. We're sort of recognizing it a little bit more. And medications, again, do help for some people when their symptoms are so extreme. But again, really important, that psychological behaviour strategies as well. God, they're all a bit tricky. Personality disorder is quite tricky as well. So the best way I can describe this, I suppose, and I don't know if anybody's had any experience working, because I know some of you have worked with mental health before, working with personality disorders. It's a sometimes subtle one and difficult to really pin down. But if you can imagine sort of personalities lying across a range, where you've got the sort of the normal range of sort of personalities, and you've got this bell-shaped curve. So I think right at the edges are sort of the personality disorders, and people, it's a really ingrained thing, your personality. And people with personality disorders, they think and they feel and they behave quite differently to average. And that can make it really difficult, and they can really struggle to function. Borderline personality, we often, is probably the most common one. And people have quite disturbed ways of thinking, really impulsive behaviour, and problems controlling their emotions, quite sort of difficult with forming relationships, and they often have a lot of anxiety and sort of difficulty functioning in the world and fitting in. So again, often then you do see people with mental health issues developing from a personality issue. And again, sometimes we see a lot of suicidal thoughts and self-harm in these patients as well, because they're finding life so difficult. So I think, yeah, just, I suppose with all mental health problems and people sort of issues, a little bit of self-care, but particularly with dealing with people with personality disorders, it can be really difficult as a therapist. You know, and I just think it's worth having a little bit of self-care as well when you're doing your assessments. Just be aware of people who kind of want to tell you everything straight away and just sort of throw everything at you, because sometimes that can be a behavioural thing, and you know, it can make things quite difficult. So I think sometimes slowing people down a little bit in your assessments, being aware of people who, for whatever reason, they want you to solve all of their problems. They want to hand their problems over to you and you solve them for them. And again, that's something that we sometimes see in people who are struggling with mental health, perhaps in particular, but in other conditions as well. You can get some people with really manipulative behaviours. So, you know, people who come to you and say, oh, you're the only one that helps me. You know, I've been to all of these other therapists and none of them helped me. Everything's been, but you really helped me. And can be quite difficult, because you can get people then who become really dependent on you as a therapist, and sort of you can get into these sort of games that people are playing, where people are constantly coming back to you with the same problem, never really working their way out of it, and sort of not, you're not able to really help that person. That, you know, they're almost just addicted to the therapy process. You know, which is fine for some people. You know, I think if you know, if you're practicing as a therapist and that's how you want to work, you're certainly probably helping those people, but you will find it difficult, and it can be hard, and you can sort of quickly burn out if you're working like that. So I think it's always worth structuring sometimes your assessments so that you've got a plan and a sort of, you know, goals and things that people, and an end point for some people is really important. So that you're making progress really with your therapy. So yoga is a really good complementary therapy for care seekers with mental health problems, and you know, I'm hoping everybody's going to be able to talk further on this, really, on the yoga side of things. And there's some evidence, there's good evidence there, you know, especially for things like anxiety, depression, stress, that yoga can be a really, really good therapy. There's just this sort of, you know, and we've all experienced this really, that the awareness that yoga just generally improves your sense of well-being in your life. You know, that you've improved relaxation, reduces your stress levels, and just makes you feel generally better. Improves your self-confidence as well, which is so important. And all the physical health improvements are going to have that knock-on effect on your mental health as well. So, you know, we've talked a lot about diagnosis, and as I said, I really want to sort of steer you away from all of this really now again. It's good to be aware of all the different presentations, but, you know, if you're suspecting a mental health issue with somebody, ask them to go and get further evaluation with a health professional. You know, just be really cautious, because I think it can be really difficult, and how you approach that with somebody, because if you're approaching them saying that they perhaps need to go and see a professional, being sensitive to their needs, and you need really good communication with people, especially if they're struggling with mental health issues, you know, to be supportive and really, really encouraging, but keeping those boundaries is really, really important. What I find is being really clear in your communication is so important, because especially if people are having issues with depression or anxiety, or especially psychosis as well, you can get misinterpreted. So you have to be really, really clear in your communication and really sensitive to how that person is feeling, and you know, how your communication is going with them. So taking lots of pauses when you're communicating, giving people time to feed back as well in the assessments, all of these kind of techniques that you can use to make sure that you're sort of on the same level as your patient, and that you're coming to a mutual understanding in your therapy then. Yeah, and I think sort of, again, you know, Boris Johnson the other day has been like sort of, yeah, everything's going to be fine by July, isn't he? And he sort of said, you know, we're all going to be cured of COVID by July. So, you know, we can't oversell sometimes, you know, therapy, and sort of, I think that can be really damaging to people. You know, I think if we give people promises that we're not always going to be able to keep, it's good to be really optimistic about therapy, but I think sometimes people can be really vulnerable if they've got mental health issues or any health issues. So always just managing people's expectations, working with them in a really hopeful way, but not making promises that, you know, this is going to fix your depression, because you're not always going to be able to predict that. I don't think anybody can, and all of your patients are so individual. So just being supportive and working through it slowly with people. So yeah, loads and loads of resources now that you can sort of signpost people to. So if you feel people just need a little bit of help, you know, I think asking them to go and look online and find some sort of mental health help online. There's loads out there. Mind is a really good one. And they actually do a 6-week sort of active monitoring sort of counselling system at the moment for people. So anybody can just ring and get 6 weeks of counselling. And there's also local, probably where you are, counselling services as well. There's different free phone numbers. Samaritans are really good if people just want to talk to somebody. You know, if they just need to have that sort of personal support, really. I haven't put it on here, but Cruise as well is another good one if people are having bereavement issues, and there's Relate if people are having relationship issues, veteran support, and for young people, the Young Minds website's really, really good as well. But again, if you're unsure, just signpost them to their NHS GP or somebody who can do an assessment then. I'll have a look on the chat, and if anybody wants to add anything in, oh yeah, Jyoti said, IAPT as a resource, improving access to psychological therapies. So that's one I'm not aware of. I'll have a look into that as well. That's fine. I'll come back to those ones. Yeah, so what I'm trying to get across, I suppose, is in your assessments, you know, you're going to get people who are going to come and they have a mental health problem, and they tell you that they have a mental health problem. But you're also going to get people who have a mental health problem and they come with something completely different and they tell you about something else. And, you know, that sort of, they may or may not know about that themselves. And you'll also get people who come and they talk about their mental health all the time, and there's no problem with their mental health. So it's just really, really, you know, it's a muddy picture with mental health. And if you're in doubt, get help, isn't it? And don't go it alone, because there's plenty of support out there. And I think with mental health, teamwork works best really. So if you've got a group of people supporting a care seeker, you know, like a yoga therapist or a counsellor, you know, maybe an occupational therapist, maybe their NHS GP. So that real group support, so you've got lots of people working together, is probably the way forward. So again, we'll move on a little bit, talk a little bit about the yoga side of things. I think yoga therapy, you know, above all, people want to be listened to and acknowledged, and sort of to tell their stories and to work through their stories themselves. So listening is often the best therapy for some people. And I think that's a really, really important thing to remember. Just that cathartic, sometimes people need to just let whatever's on their mind off their chest, and that really, really helps them. And if you can offer that supportive, relaxing space without any judgment, you know, that's so important. And allowing people that time and space to connect with their own health and well-being, and encouraging self-care and self-compassion, because people with mental health issues, as well as lots of other health issues, really beat themselves up a lot of the time and feel really bad about themselves and have low self-esteem. And again, you're supporting that healthy lifestyle, that physical fitness and well-being with yoga therapy. That's probably just on a very basic level. You know, and I know Dr. Ananda talked a little bit more then about, you know, sort of taking things further really in terms of the psychological impact of yoga. That sense of coherence I really liked his sort of his take on things there, and just remembering that sort of, you know, health is this kind of dynamic state, isn't it? So, you know, our mental and our physical health all coming together, you know, and not taking things to extremes, because I think what people with mental health issues sometimes struggle with is that sense of balance and equanimity, the focus as well. So, you know, there's lots and lots of ways that yoga therapy can help. I sort of talk a little bit about sort of safety as well. So, you know, I think this would be really, really uncommon. And you know, I think I've experienced it a few times, but it's not common. You know, most people are not going to be violent or aggressive, but you will get some care seekers who maybe have anger issues. And it's worth always just being a little bit aware yourself that you're practicing in a safe environment and that you're keeping yourself safe. You know, it's not nice if it does happen, if somebody's aggressive to you. So, you know, just always think a little bit about your personal safety and how you're practicing. Confidentiality is obviously always really, really vital and important. But if somebody does disclose something to you in an assessment, so you feel that somebody else is at risk of really serious harm, then you should report it. So you have a duty to break confidentiality if you feel that somebody is at risk to others of serious harm then. And, you know, you may at some point sort of in your assessments, somebody may be telling you about how they're feeling, and they may have been experiencing suicidal thoughts. You know, so that should always be assessed, obviously, by a health professional. But I think really, really important, if somebody does disclose that's how they're feeling, don't panic. You know, I think suicidal thoughts are probably a lot more common than we sort of think they are. And not everybody who's having suicidal thoughts goes on to do anything drastic. So if somebody does open up to you, there are ways that you can sort of deal with that then. You know, don't be afraid to ask about it if people are sort of wanting to talk about that side of things. And just, you know, ask them to explain how they're feeling, what kind of thoughts they're having. Emphasize maybe what's stopping them and the protective factors, we call it. So, you know, how people are sort of working through those thoughts. But, you know, I think, yeah, get people to get some urgent help if needs be, and just let them know that help is out there if they are feeling that bad, isn't it? Just have a quick look at the chat again. Yes, that's really helpful, Donna, actually. Yeah, there's a few different suicide first aid type training courses that you can go on, and that would be something, if you wanted to look onto that, it'd be really, really useful. So I think Shirley's mentioned something in the chat there, and I think there's a few different ones out there. The assist training I've heard of as well. So that's, yeah, something that you can look into if you feel sort of that you're going to be working a lot with people with mental health issues, and that's something that you might come across and feel that you need a bit more confidence with.